Hello, everyone. My name is Sean Allen, and I'm an assistant professor of social work at Concord University. And I'm joined today by Professor Robin Durham, who is also an assistant professor of social work here at Concord. And we have the pleasure of talking to you a little bit about our MSW program here at Concord and some of the opportunities you would have if you chose to pursue a master's degree in social work. So first, we're going to talk to you a little bit about our specific program at Concord. The mission of our program is we are preparing our graduates for advanced generalist practice in social work. And we also have a specialization in working in rural areas. So if you're someone who is interested in practicing, like here in Appalachia, in rural West Virginia, our program is focused in that and definitely would be a good fit for you. Also, we feel like, preparing to work in rural areas can also translate into working in other areas as well. So we do talk about some of the differences in urban versus rural practice and those sorts of things. So if you have interest in those areas, we're definitely a good place that we think you would fit in. Our program has been fully accredited by the Council on Social Work Education since 2015. And we technically offer two different programs or tracks. The first is our standard or generalist program. This is for people who maybe don't have a background in social work, or perhaps you have a degree in something other than social work from your undergraduate degree. So if you're fit into that world, and maybe you're doing something else, or maybe you have a degree in something else, but you're wanting to jump into social work, this would be the program for you. To join that program, you would have a 4-year degree from somewhere that is an accredited program, and you also would need to go through our application process, which we'll talk about. That program, if you do it full time, takes 2 years, but we also do have part-time options available. Also, we have our advanced program for students who have a BSW. So if you're looking for a program, you've completed your undergraduate degree in social work and you're wanting to do the MSW, you could possibly be eligible for our advanced program, which takes 1 year if you do it full time. And again, there's part-time tracks that are available there as well. Our program is really designed for individuals who are working. So if you come into our program and you're doing it full time and you decide that maybe you need to cut back to part-time, that's a possibility, and vice versa is true as well. So you see there on the screen, we have a couple of the GPA things as well, but you can find all of that information on our website, which we'll give you the address for here in just a little bit. Our program also has start dates in both the fall and the spring. So, you can really apply to our program just about any time, and your application will get reviewed for one of those start dates, depending on when you apply. Some of the benefits of our program is it's 100% online. So you can do our program from absolutely anywhere. We've had students as far away as Canada and California, and we have many people right here in our backyard in Athens. So wherever you are, our program can be a benefit to you. We offer both synchronous and asynchronous classes. And what that means is some of your classes are 100% online, without any face-to-face interaction, while others may require that you meet via Zoom a couple of times throughout the semester to do a few things. So there are those components that are built in. So it just depends on the class. Our cost is $485 per credit hour, and there are some additional online fees that go in with that. And if you're someone who happens to be outside of West Virginia, that cost is the same for you. So that's the same price in state and out of state. As I mentioned earlier, our specialty is in rural practice, and the size of our classes tend to be 15 students or less. So even though we are an online program, we still get to know you, we still get to know your interests, who you are, and all that sort of thing. So you still get that, small school feel from us, even though, this program is completely online. Some things to consider when you're thinking about our program, or really any online program, is that some students do prefer NC classes, and that's okay. And sometimes students say they don't feel as connected to the campus as they do with those those in-state students, excuse me, those in-seat students may. However, we do make every effort to keep you involved as much as we can. Also, online doesn't mean easy. Some students get that confused, so keep that in mind. It doesn't necessarily mean easy. Our program is rigorous as any other program would be, but it's doable. It's especially doable for those of you who are working and managing all these live situations that you may have. There's some skills that are definitely required to be successful in online education. Of course, you have to be dedicated. Having self-discipline and self-motivation is really important, and also the ability to use some technology, such as basic computer, Zoom, Blackboard, some of those kinds of things. Here is just kind of a quick little overview that shows you our entire program and what it entails. Lots of times students have questions about field. You'll see that there is a generalist field practicum that students complete who are in that generalist program we mentioned. And there's also advanced field that all students complete. Now, our fields are part-time in nature, which means you complete roughly 15 to 20 hours a week, depending depending on which track you're on. And also, our field goes across several semesters. So that generalist field goes across 2 semesters, and that advanced field goes across 3. And our great field director, Terry Philpott, helps you through that process. So don't let field be something that keeps you from applying to a social work program. There are individuals there to help you through that process. So as far as applying goes, some things you need to know. For that advanced program, if you're coming in with a BSW, that BSW primarily needs to be completed within the last 7 years. However, if you've gotten your BSW before that, don't let that deter you. Please apply. We take your entire application into consideration. Your entire GPA needs to be above a 2.75 with a 3.0 in your social work courses. Again, if you're a little bit under that, apply. We look at you as the whole, not just those specific things. As we mentioned earlier, the generalist track, you need to have a bachelor's degree from an accredited institution. You submit all your transcripts from those institutions so we can see your GPAs there. The overall GPA requirement is a 2.5 with a 2.75 in your last 60 hours of coursework. Again, if you're under that, please consider applying anyway. So other things you need to know is when you apply, you will designate if you're applying to the generalist or advanced program. Keep that in mind. You're required 3 letters of reference, and on our website you can find out the requirements for those, and as well as a personal statement that you'll write. And again, our website has specifically what's required in both of those. The application fee is $30, so that's certainly doable, and there's no GRE requirement, which is something that's really important, and so that alleviates some stress for a lot of folks. So if you're interested in applying to our program, our fall deadline every year, you apply by April 15th to be considered for the fall deadline, and you apply by November 15th to be considered for the spring deadline. And if you have any questions, we have the great Vanessa Howell's information here. She is our administrative associate. So you have all of her information there. She's more than happy to help you through that process. Just shoot her an email, as you can see on the screen. And there at the bottom, concord.edu/SWS is where you can find specific information on the application process, what's required as far as what's required of the letters of reference, what's required in that personal statement, and all that sort of thing. With that said, now the great Robin Durham is going to talk to you a little bit about behavioral health and having an MSW.
Thanks, Sean. I'll try to follow that very well. So my name is Robin Durham, and I've been a clinical social worker for a very long time. We'll say 30 plus years. So what I want to talk to you about a little bit is about just kind of what we do. So when we think about social work practice and behavioral health, we really work towards people's well-being. Well, first of all, we look at assessment, and that's kind of an ongoing thing. Providing a diagnosis in terms of what's going on with this person, which then goes into the treatments that we're going to do. What we hope to do sometimes is prevent people from having more significant impairment from mental illness, but also when people come in with kind of life issues, is from it turning into something else. we're treating trauma and substance use issues and just general life situations. And also, we take what we call biopsychosocial approach. So we're looking at the whole person. So as you can see below here, we look at several different areas that we incorporate into what we're doing. And then also on top of that, we work with, individuals, groups, families, and sometimes at larger, when we talk about people who do disaster work, they may be working with the whole community in terms of mental health. So that's just some of the areas that we look at. So the next thing is we talk about licensure. Now, here's the nice thing. When you graduate with your MSW, you, at least in West Virginia, now if you live out of state, you need to check the requirements there. But for West Virginia, you can go right out and start practicing mental health with what we call the LGSW. That requires no supervision. You take the test, you start. Now, you are limited in what you can do in the practice world a little bit, and you need to be under supervision to do some of the clinical services providing therapy. For those of you that know you want to be a therapist, then what I would tell you is you skip the middle and you go right to the top. So once you get that LGSW, you get under supervision. Well, back up. When you work in a clinical setting, you get under supervision of an LICSW, 2 years, and then you can sit for that exam. That allows you to do independent practice. Now you might say, well, what's that middle one, the LCSW? You can provide therapy at that level too, just again, not independently. Again, if you say, well, I don't mind working for an agency, I don't mind being under supervision, then fine. I mean, you're okay. So all 3 levels, you can provide therapy services. Independent LICSW, you're providing truly psychotherapy services, more specialized. So this is always neat to learn because sometimes with social work, we don't get the dues that I think we're owed, but we are one of the largest providers of mental health services. And there's more clinically trained social workers than there are the other mental health providers, which you don't always hear about that. The VA employs, they love them some MSWs. I'll tell you right now, they employ a lot of MSWs in different programs. And we talk about people that are doing disaster services, disaster mental health services. Again, lots of social workers are doing that. So we're out there, but I don't know that we always are recognized for being out there. So let's talk about where. And again, you can see the list here, so I'm not going to talk about them all, but basically, we're seeing more of an expansion in places that provide mental health services. And these are just, there may be more than just here, but everywhere from, private practice, and that may be your own private practice if you're an LICSW or working with another one, to residential inpatient, to corrections. It's just expanding. Schools are starting to, if they're not hiring their own, they're contracting with agencies to put therapists in the schools. So it's really out there. The online therapy providers, we certainly see the commercials. Again, you have to be a clinical provider, but there's lots of opportunities and there's need. And that's the thing we want to talk about with rural social work is, when we talk about generous rural, you have to wear a lot of hats, when you're doing what you do. And I think that's not a bad thing, but, rural areas are truly lacking. And so we need people out there providing good quality, competent, ethical services. This is just, again, employment, it's growing. And again, so I think it's a career that you can look at and say, there's a great possibility I'm going to get a job in the area I want to look at.
Right. Thank you, Robin, for sharing all that. And of course, we gave you Vanessa's contact information earlier. And here's both contact information for Robin and I. And I'm sure I can speak for Robin too. And I say, if you have any questions or anything that we can do to support you, don't hesitate to reach out. You have both our phone numbers and our email addresses. And with that, we'll bid you adieu. Thanks for listening, and we hope we hear from you soon.